Um, Hello, good morning to everyone. Welcome to this PBSerum webinar. Today we are going to talk about PBSerum Medical line. But first of all, I would like to introduce myself because I know that many of you don't know me yet. My name is Íñigo Paredes Hermosilla. I am a biotechnologist and expert trainer at Proteus Biotech. Probably you know my colleague, Sara Cardeñoso. She's expert trainer at Proteus Biotech as well. Just to remind you that our main role is to give you scientific advice and all the technical support that you may need regarding PBSerum products. During this seminar, I will explain all this PBSerum medical line, and my colleague Sarah is here with me. She's at the background. She will be answering all your questions. Okay, so please write all your questions in the chat panel that you will find in this platform, so that my colleague Sarah can answer them. Okay, so don't be shy and go ahead with your questions during this presentation. Well, I hope you can see my screen. In case you cannot see my screen, please let me know, okay? But I hope you are seeing my screen right now. Well, here we have the agenda that we'll follow during this PBSerum webinar. First of all, an introduction about PBSerum for all the people who don't know PBSerum. Then we will go into detail about each one of the biological ingredients that we manufacture, science behind PBSerum. We will see the different mechanisms of action of our biological ingredients. Then we will learn how to prepare the product and basic advice. And finally, we will conclude by seeing several clinical cases and protocol review about our pathologies, the pathologies that we address with PBSerum Medical. Well, so let's get started. Introduction. First of all, who are we? Well, Proteus Biotech is a Spanish biotechnological company whose main goal is to research and develop about dermatological products. We manufacture biological ingredients with high potential within aesthetic medicine field, okay? And we always follow high quality and high safety standards. As you can see here in the map, our laboratory is located in Albacete and the office is located in Madrid, the city where I am right now. Nowadays, PBSerum is internationally growing. We are already present in 45 countries from all over the world. And here we have two products. On the left side, we have our special hyaluronic acid. And on the right side, we have three different products. We have high, medium, and low. These products contain our recombinant enzymes. We use a combination of hyaluronic acid as one of these enzymes in order to treat fibrotic skin diseases mainly. Regarding hyaluronic acid, we are talking about a high molecular weight hyaluronic acid. This is slightly cross-linked. This is not totally cross-linked because this is not a filler. Okay? This hyaluronic acid is not intended to fill wrinkles. In this case, we use this compound with a different purpose, okay, with medical purpose. We are using this hyaluronic acid as an anti-adhesion agent in order to prevent tissues from collapsing. We use this hyaluronic acid in order to treat and prevent fibrosis so that we can regenerate and reorganize collagen matrix in different fibrotic skin disorders. As you can see here, this is the concentration, 8 milligrams per milliliter, with a volume of 1.5 milliliters, and we see CE marking. Regarding enzymes, we manufacture different recombinant enzymes, lipase, collagenase, and lyase. All of them come from bacterial origin as they are recombinant enzymes. To remind you, here we have the mechanism of action of enzymes. Enzymes, as you probably know, are specific proteins that carry out biochemical reactions within our body. We already have enzymes within our organism. Enzymes accelerate metabolic reactions. This is the mechanism of action. Here in gray, we have our enzyme. This enzyme will bind specific substrate. Enzymes have a very high affinity for specific substrates. Okay, so then we have this enzyme substrate complex, and the enzyme will turn this specific substrate into the product. Okay, the enzyme is going to degrade this specific substrate. This is how it works. And here we have the different indications that we address with our products. Remember that we have 3 products containing enzymes, high, medium, and low. All of them contain our 3 enzymes, collagenase, lipase, and liase, but in different proportions depending on the pathology that we want to treat. In the case of high, we have a higher amount of collagenase because this product is intended to treat severe fibrosis mainly. So we use a combination of hyaluronic acid plus high product in order to treat post-surgery fibrosis, different kind of scars, atrophic, hypertrophic, and even keloids. We also address this typical orange peel skin that we find in cellulite. We also treat stretch marks and burns. In the case of medium, in this case, we have a higher amount of lipase because this product is intended to treat not only fibrosis, but also fat accumulation. So we use a combination of hyaluronic acid plus medium in order to treat double chin, localized fat, and lipoma. And finally, we have low product. In this case, we have equal proportion of the 3 enzymes. In this case, we use a combination of hyaluronic acid plus low in order to treat flaccidity, periocular bags, facial reshaping, and hand rejuvenation. Well, within this PBSerum medical line, we also have other products. We also have filler correctors. They contain other recombinant enzymes. This is hyaluronidase. We use these filler correctors in order to degrade hyaluronic acid fillers. In this case, we have 2 different versions of the product. We have a total corrector, which is more concentrated, and a partial corrector, which is less concentrated. Total corrector is intended to completely remove hyaluronic acid fillers, and it is used in cases of severe damage, for instance, vascular occlusion or necrosis in the tissue. In the other case, when we need to not to remove the filler, but just to retouch a little bit, in that case, we would use partial corrector. As you can see here in this chart, we can see how our total corrector is able to degrade different kind of fillers within the time. Okay? Please bear in mind, it's very important to bear in mind that our laboratory complies with all the requirements in order to manufacture Class 3 medical devices. Okay? We comply with ISO 13485, very important. All our products are manufactured within a clean room grade A by means of pharmaceutical quality. We perform highly controlled and automatized process. We use cutting-edge technology and we ensure sterile conditions. Our enzymes come lyophilized. Lyophilization is a highly efficient conservation technique. Okay, it involves 2 steps. First of all, a freezing of the product, and then a dehydration of the product. In this technique, we are going to remove all the water content. So the final product will be a highly stable and sterile powder, dehydrated powder. Okay, so there is no need to add any additive nor conservative. This is the main advantage of this conservation technique. Please take into account that once we want to use the product, we are going to reconstitute this lyophilized enzyme by adding saline solution. And once we have reconstituted the vial, please bear in mind that we have to use the whole content of the vial for that specific session. So one vial is intended to be used in just one session. We do not recommend to store product left for future sessions because we could lose enzyme activity or sterility. Well, after this introduction, in the following part of this webinar, we are going to focus on the different mechanisms of action. We are going to learn how our biological ingredients work at the level of the dermis in the tissues. Okay. Well, I remember you that all the questions that you may have, please make them by writing them in the chat panel so that my colleague Sarah can answer the questions. Okay? Well, why do we use a high molecular weight hyaluronic acid? This is a very interesting question. In the scientific literature, it has been widely reported that high molecular weight hyaluronic acid is able to decrease fibrosis area in different tissues. As you can see here in the first chart, we can see how this high molecular weight hyaluronic acid is able to reduce the rate of fibrosis area in different tissues. In this case, this is endometrial tissue. We cannot observe the same effect when applying low molecular weight hyaluronic acid. So this is why it's very important molecular weight in this case. In the other charts, we can see that high molecular weight hyaluronic acid is able to decrease the expression levels of pro-fibrosis biomarkers in the tissue. We have different pro-fibrosis biomarkers, such as transforming growth factor beta 1 or connective tissue growth factor, as well as different collagen fibers. We can see here in this blue how this high molecular weight hyaluronic acid is able to reduce this the expression of this biomarker, therefore is able to reduce fibrosis. So this is the main reason why we use this hyaluronic acid as an antifibrotic agent. Regarding enzymes, nowadays we have different kind of enzymes placed on the market. It's very important to take into account enzyme origin because the effectivity of enzymes will depend on this enzyme origin. We could be talking about enzymes coming from animal or vegetal, but in that case, we would have low purity, low productivity, and these enzymes are usually applied for industrial applications. Other kind of enzymes come from bacteria or yeast by means of fermentation. In this case, we would obtain moderate productivity, and these enzymes are applied in the alimentary and cosmetic industry. But in our case, we use genetic engineering in order to develop recombinant enzymes so that we can obtain high purity and high productivity. By doing this recombination technology, we can apply our enzymes to treat different medical disorders. And here we have the process. This is the recombination technology that we carry out in the laboratory. This is a complex process. I will explain very briefly. It involves several steps. First of all, we have to identify and isolate our gene of interest. Okay? As enzymes are proteins, they are encoded by genes. So first of all, we identify the gene of interest that will encode our protein, our specific enzyme. We are going to place this gene into a host cell. We use bacterial cells as a host cells. In our case, we use Escherichia coli. But we cannot simply take our gene and place it into bacterial cell, because bacterial cell will degrade our gene. This is the reason why we need to use a vector, what we call as a vector. Our vector is another kind of DNA. This is a plasmid DNA. It will behave as a vehicle, okay? So we are going to paste our gene of interest into the vector. Therefore, we obtain one molecule of recombinant DNA that contains our gene of interest plus the vector. This vector is already present in bacteria. So by doing this, we ensure that our gene is not going to be degraded once it is placed into the bacterial cell. Okay, so now we can carry our gene from outside to inside the cell. Well, in this phase, bacterial cells will behave as a factory. They will grow in a medium with the appropriate nutrients. So we will have more and more copies of our gene. Therefore, we will have more and more copies of our protein, our specific enzyme. Then we have to isolate the proteins from the rest of the bacteria. And finally, we purify our specific enzyme in order to separate it from the rest of the proteins. This is how we get our highly pure enzyme. Why do we do all this complex process? Well, we perform this recombination technology because we want to achieve higher purity, higher stability, higher specificity, and lower immunogenicity. This is the reason why we perform such a complex process. Okay, in our case, recombinant proteins are non-glycosylated proteins as they come from bacterial origin. So they are smaller than those proteins, those enzymes that come from animal source. Therefore, they are less immunogenic. It means that the probability for triggering immune responses or allergic reaction is much lower, is minimal. In other words, they are safer than other enzymes that come from a different source. Very important. And here we go with our enzymes. Our first enzyme, this is lipase. Lipase will degrade triglycerides in the adipose tissue. It will turn triglycerides into free fatty acids plus glycerol. And then these free fatty acids will be uptaken by different tissues in order to obtain energy. Okay, we use lipase in order to reduce adipocyte volume, in order to reduce fat. It's very important to take into account that this enzyme enter the cells, the fatty cells, without breaking cell membrane. It's very important because by avoiding breaking cell membrane, we are going to maintain the integrity of the tissue. We are not causing necrosis. Other important fact is that human lipase is regulated by hormones, but our enzyme is not going to be regulated by hormones. Normally, human lipase is stimulated by catecholamines and inhibited by insulin, but our recombinant enzyme is going to work independently. Okay. So this is not sensitive to hormones, which is an advantage because we can apply our enzyme at any time. Well, here we have an example. This is a mother fat pad obtained after surgery. And here we can see how there has been a reduction in the volume after lipase application. Well, collagenase is our second enzyme, recombinant enzyme. Collagenase will degrade collagen fibers. So we use this enzyme in order to destroy non-functional and wrongly shaped collagen fibers that we find in the dermis. We can apply this enzyme in different situations. For instance, we can apply in this specific structure, fibrotic septum, that we find in fibrotic nodules in cellulite, or in post-surgery fibrosis, for instance. In this case, we are going to apply collagenase in order to destroy this erratic accumulation of collagen fibers, okay? These collagen fibers that are surrounding these hypertrophic adipocytes here in green. So by destroying these collagen fibers, then we also can apply lipase in order to decrease the volume of these adipocytes. So as you can start wondering, we are going to use enzymes together for this reason. Okay. Other applications is tissue remodeling in scars. We are going to apply collagenase in order to renew this collagen matrix in different kind of scars, hypertrophic, atrophic, or even keloids. And finally, we can apply collagenase in order to reduce flaccidity. In the case of flaccidity, we have these old and non-functional collagen fibers that are not able to hold the framework, the tissue. So we're going to apply collagenase in order to destroy these old fibers. And additionally, collagenase is going to stimulate fibroblasts to synthesize new, stronger, and thicker collagen fibers, as you can see here. And these new and thicker collagen fibers are able to hold the tissues. Our third enzyme is lipase. Lipase degrades those polysaccharides that accumulate at the extracellular matrix, those polysaccharides that are responsible for water collection. So by applying this enzyme, we're going to release this liquid trapped in the extracellular matrix. So we're going to reduce edema. Additionally, we increase permeability of the tissue, and therefore we are going to help other ingredients reach the site of action by decreasing this water content. Well, what is the rationale to use these three enzymes in combination? Why do we use all these three enzymes together? As you can see here, we have this picture. This is a representation of the extracellular matrix. As you can see here, we have different fibers. We have elastin, proteoglycans, polysaccharides as well, and collagen fibers, okay? And here we have cell membrane. Imagine that this is a fat cell, and this is an adipocyte, okay? So, as I have already mentioned, these proteoglycans, polysaccharides, are able to collect water. So collagenase and lipase are not going to be able to bind their specific substrate. They are not going to be able to reach the site of action. This is the reason why we use lipase. Lipase will reduce this liquid retention so that lipase can enter the cell and collagenase can bind collagen fibers and degrade them. So finally, we obtain a synergy effect. This is the reason why we use the three enzymes together. Here we have the different pathologies that we address. We use different products depending on the pathology. In the case of fibrosis, scars, cellulite, and stretch marks, we use high product. In these cases, we are going to apply this product by means of intralesional infiltration. We are going to apply high directly into the fibrotic tissue, fibrotic nodules. In the case of fat, double chin, facial remodeling, or localized fat, in those cases, we are going to use medium mainly, okay? In this case, we have to make sure that we apply medium by means of subdermal infiltration. We need to make sure that we reach the adipose panicle. And finally, we can treat flaccidity and periocular bags. In those cases, we're going to use low mainly. It's true that we can use high in those cases when we want to perform a very intensive treatment in flaccidity, but in most cases, we're going to use low. Well, in these two cases, we are going to apply this product by means of superficial infiltration. Well, after this part, now we're going to learn how to prepare the products. We will talk about different volumes and different applications. Okay, and finally, I will give you some tips about how to get the optimal response. Well, here we have a video. We have our hyaluronic acid. First of all, we are going to add this 1.5 milliliters of hyaluronic acid into the vial containing the lyophilized enzymes. So we are going to reconstitute these dehydrated enzymes by adding hyaluronic acid, 1.5 milliliters. We are going to dissolve the enzymes by shaking gently. Okay. And then we are going to add an appropriate volume. Oops, sorry for that. Here we go. As I was telling you, now once we have applied hyaluronic acid, then we are going to add saline solution. We are going to add a different volume depending on the size of the area that we need to cover. Okay. So we add saline solution, and now the product is ready to be applied. Saline solution is including within the enzyme packaging. Well, here we have the dilutions table. As I was telling you, we have on one side hyaluronic acid, 8A 1.5. We have 1.5 milliliters, okay? And then we have the reconstitution buffer, which is including within the enzymes product. We have 18 milliliters in the cases of high and medium, and 12 milliliters in the case of low, because this product is intended to treat smaller areas. But so as maximum volume per unit in each product, we can obtain almost 20 milliliters in the cases of high and medium, and 13.5 milliliters in the case of low. And as minimum volume, we need to add 3 milliliters. It means 1.5 milliliters of hyaluronic acid plus 1.5 milliliters of reconstitution buffer. This is the minimum volume that we need to apply in order to properly dissolve the enzymes. Remember that we can use lidocaine 2%. It is up to you if you want to add lidocaine. In case you add it, you must add it in the end, okay? And some doctors use lidocaine in order to reduce painful sensation, but this is up to the doctor. Regarding the number of sessions, well, on average, the number of applications required is around 2 and 3 sessions. Although from the very first session, we can observe visible improvement. However, we have to take into account that there are several pathologies that may require some more sessions. For instance, very severe fibrosis, or maybe scars, old scars with many years of evolutions. But on average, between 2 and 3 sessions. Okay. Regarding the frequency of the treatment, it's important to take into account that we are going to apply the product once every 2 weeks. This is one session every 15 days. Well, our response will depend on different factors. Of course, patient elections. We have to identify the correct indication. Okay, we have to perform a correct diagnosis. And also application level. This is crucial point, because we have to apply enzymes where this specific substrate is located. Okay, if we apply enzymes where the substrate is not located, nothing happens. Okay, we are not going to observe additional side effects, but nothing happens. So it would be wasting enzymes. Okay, so we have to identify the correct application level, superficial in case of acidity, or deep application level in the case of fat. Okay, very important. Of course, the following factor has to be the product. Okay, because as I have already mentioned, we have different proportion of the enzymes. So we have to choose the correct proportion depending on the pathology that we are addressing. Then the amount of product, of course, the maximum amount of product that we can apply in one session to treat one specific area is 60 milliliters. It means 3 units, okay? 3 products as maximum in one session. And regarding the number of sessions, well, we have already seen that between 2 and 3 would be enough, but we have to take into account the inter-patient variability. Application levels are very important, as I was telling you. In the case of medium, we have to make sure that we reach the adipose panicle, okay? In the case of acidity, it is going to be intradermal infiltration and superficial infiltration in most cases, okay? And in the case of fibrosis and scars treatment, we are going to apply high by means of intralesional infiltration, that's directly into the fibrotic nodules, okay? In most of the cases, we are going to use a 13 millimeters length needle in most of the cases, but we are going to see that in specific situations, we will need longer or shorter needles, but as general rule, 13 millimeters length needle. What can we expect after the treatment? Well, the only side effect that we are going to observe is local inflammation, swelling, erythema, edema, pain, or discomfort. This is the only side effect. It will last between 4 and 72 hours, but then it goes away. And there is no need to use very specific drugs, but this is up to the doctor to use anti-inflammatory drugs or painkillers in order to reduce painful sensation. As post-treatment advice, please take into account the following advice. Avoid intense exercise the following 24-48 hours after the treatment, okay? Avoid infection sources during the days after the treatment, for instance, swimming pool and sauna. Please remember to drink plenty of water and reduce carbohydrate intake when treating localized fat, okay, in order to make the therapy more effective. And finally, use sun protective factor if sun exposure. Regarding contraindications and precautions, please bear in mind that our products have not been tested on pregnancy and breastfeeding population. So don't apply these products on this specific population. Another contraindication is local or systemic infection. In this case, we will have to wait until the infection disappears. Well, and then the following points, in the following cases, we have to be cautious, okay? Regarding autoimmune diseases, atopic diseases such as atopic dermatitis or asthma, in those cases, we will have to assess the severity of the disease. If we are talking about very localized and mild atopic dermatitis, in that case, we could apply the products. But in the case that we are talking about a very severe atopic dermatitis, in that case, we will have to think about it, okay? So, following the same rationale, we have to take into account unsolved allergic reaction or cutaneous hypersensitivity. We have to bear in mind vascular and coagulation problems because we are talking about products that involve several punctures. So we have to take into account its coagulation problems, okay? And finally, in case of vaccination, we have to wait for 15 days in order to let the immune system recover steady state. Because after vaccination, immune system is activated. So we have to wait 15 days. Well, I remember you that you can make all your questions by writing them in the chat panel so that my colleague Sarah can answer them. So please go ahead with your questions, and my colleague Sarah is going to answer as many questions as possible. Well, we are reaching the end. In this last part, we are going to focus on the PBSerum in clinical practice and protocol review. We are going to see several clinical cases. But fibrosis is one of the pathologies that we address. In this case, we use HAI. We use a combination of hyaluronic acid plus HAI, because remember that in this case, we need a higher amount of collagenase. So this is why we use HAI product. In this case, we are going to apply the product by means of intralesional infiltration. We are going to perform retro injections. As you can see here, we are going to place the product at different levels of the dermis. Okay, we are covering different levels where fibrosis is present. Additionally, we can perform this fan technique, what we have called fan technique. It involves changing injection angle in order to cover all the angles, all the injection angles. Well, in this case, we are going to use a 13 millimeters length needle, as I have mentioned before. But in case we need to address a very deep fibrosis, it is possible to use a longer needle in those cases. In those cases, we would use a 25 millimeters length needle. But as a general rule, 13 millimeters length is okay. Well, in the case of scars, in this case, we are talking about fibrosis as well. So we are going to apply HAI. We are going to apply the product by means of intralesional infiltration. Here, the idea is to perform retro injections in order to fill the whole scar. Okay, we are going to fill the whole scar at different levels. Okay, regarding volumes, it will depend on the size of the scar, but here we have some orientative amounts volume. These volumes are not compulsory, but this is just to let you make an idea. Okay, 5 millimeters in the case of short scars, 9 would be enough in the case of medium-sized scars, and finally, for long scars, we would use the whole content of saline solution. Here we have several clinical cases, clinical examples. This is a post-surgical scar. This is an example coming from Turkey. And you can see here the result after one session. You can see how we have recovered symmetry at both sides of the scar. We have improved scar appearance. This is an example of the keloid scar. This is from Romania. And this is the result after 2 sessions, 1 session every 2 weeks, remember. Okay, in this case, we apply the product directly into the keloid, into the fibrosis, this erratic accumulation of collagen fibers. We can see here how there has been a reduction in the volume of the keloid. Well, regarding cellulite, we are using HAI, a combination of hyaluronic acid plus HAI, in order to treat fibrotic nodules in cellulite. Those fibrotic nodules that are responsible for this typical orange peel that we find in cellulite. So in this case, we are going to apply the product by performing retroinjections in the nodule, okay? We are going to cover superficial, medium, and deep levels, okay, in fibrotic nodules. We're going to place between 0.5 and 1.5 milliliters in each fibrotic nodule, okay? Remember that, first of all, we must identify the fibrotic nodules and then we apply the product. Here we have an example of cellulite. This is the result after one session. We can see how there has been a reduction in this roughness. We have obtained smoothing effect. So the fibrotic nodules have been improved. Another example of cellulite. This is the result after one session. Another example coming from Italy. We can observe very clearly here these fibrotic nodules responsible for this orange peel skin. And after applying high product, we are going to obtain this smoothing effect. We are going to decrease this roughness. Well, we continue with localized fat. In this case, we are going to use a combination of hyaluronic acid plus medium. Remember that medium contains a higher amount of lipase, as this product is intended to treat not only fibrosis, but fat accumulation. So in this case, we are going to perform retro-injection in the adipose panicle. Okay, we're going to place the product at different levels. Please make sure that you reach the adipose panicle. In some cases, we need to go deeper. So in some cases, we are going to need a longer needle, not a 13 millimeters one, but a 25 millimeters length needle, okay, in those cases. We are going to place between 0.2 and 0.4 cc's per puncture, okay? And we can treat localized fat in different parts of the body. For instance, abdominal fat, localized fat in back, as you can see here in this picture. Also, we can treat localized fat in the arms and other locations, body locations, where we can find fat accumulation. Here we have a video, an example. This is the application of medium by using a needle. Okay, we are going to perform several punctures. We are going to leave 1 centimeter between punctures. Okay. And the second video here, we can see the application of this product in other location. Okay. We need to make sure that we reach the adipose tissue. Well, this is an example. Localized fat in abdomen. Okay, we can see here the reduction in abdomen size. Well, regarding double chin and facial remodeling, in this case, we are using medium as well. We are going to perform retro-injections in the adipose panicle in these anatomical locations, okay? We recommend to draw a mesh in order to identify the injection sites. We can also perform this fan technique in order to cover every injection angle. And we are using the following amount between 10 and almost 20 millimeters, depending on the size of the double chin. We are going to place between 0.2 and 0.4 cc's per puncture. Well, this is an example. As you can see here, we can use both needle or cannula. This is an example of cannula. Okay. In this case, we are introducing the product by means of cannula. We are placing the product in the cheeks, okay, in order to obtain a facial remodeling. In this following video, we are applying the product in this lower third, okay, in the submaxillar triangle. Make sure that the cannula reaches the adipose tissue, and we are going to leave the product in every location. Well, this is other example. In this case, we have this mesh. This doctor has drawn this mesh in order to identify the injection sites, and she's going to treat Joel. Okay, we can treat Joel by applying this product, medium. We are going to reduce fat accumulation in Joel. This is an example of double chin. This is an example coming from Spain. As you can see here, there has been a reduction in this fat volume, fat accumulation, after 2 sessions, 1 session every 2 weeks. And we obtain this nice effect. But regarding flaccidity, in this case, we are going to apply a combination of hyaluronic acid plus low. We are going to apply this product by means of intradermic and superficial infiltration. Okay, we can draw a mesh, okay, in order to to identify the area to treat. In this case, we would apply the product along these lines, okay, superficial infiltration. In this other image, we are going to perform what we call bunching technique. It means that we are going to create superficial papules, okay? In this case, we can use not only 13 millimeters length needle, but a shorter one. We can use a 4 or 6 millimeters length needle because we need a superficial infiltration. This is an example of neck flaccidity. This is the result after 2 sessions. We have recovered elasticity and firmness in neck. Other example of flaccidity, in this case, this is flaccidity in the armpit, okay? This is the result after 1 session. And we have increased firmness, we have decreased this roughness and sagginess. Other example, this is flaccidity in knees. As you can see, we can treat different kinds of flaccidity. We have this sagginess skin, and we can recover firmness and elasticity by applying this product low. Well, and finally, here we go with periocular bags. Well, we can treat different kinds of periocular bags. In these cases, we are going to apply a combination of hyaluronic acid plus low. In this case, we do not need to use the whole content of saline solution. Okay, we're going to use just 3 or 4 millimeters because we need to apply between 1.5 or 2 per eye bag. Okay, 2 millimeters as maximum per bag. Well, when we are treating not back, but just periocular flaccidity, periocular wrinkles, as you can see here in the first video, we are going to apply the product by creating superficial papules, in this case of periocular flaccidity. Okay, we're going to use a mesotherapy needle. As I was telling you, a shorter needle. In this case, there is no need to use a 13 millimeters needle. We're going to use a 4 or 6 millimeters length needle. As you can see here, we are creating these papules covering all the periocular flaccidity in this case. This is another example. We're using a mesotherapy needle. We need to leave 1 centimeter between punctures. Okay? Well, and finally, this is an example of eye bags, but in this case, we are using cannula. Okay, this is optional. This is up to the doctor. By using cannula, we can avoid bruising. Okay, this is the reason why some doctors prefer to use this cannula. we are going to introduce the cannula and we are going to place the product from the lacrimal to the opposite side. Okay. Well, and I think this is the last case, the last protocol that we review. Well, we are going to see several clinical cases of eye bags. In this case, we have an example coming from Poland. As you can see here, we have these eye bags. Some of them contain not only edema, but also fat accumulation. And we are going to reduce this bag volume, as you can see here, after one session. Another example for periocular bags. This is the result after one session. Okay, so I think this is the end. Thank you very much for attending this webinar. Now, well, I'm going to check if there are some questions that have not been already answered, but I'm sure that my colleague Sarah has been answering all your questions. But this is the moment to discuss, so please write your questions if you have more questions to make, okay? Okay, I remind you that this webinar has been recorded. So this webinar will be sent to your distributor, to your local distributors, okay? Bear in mind, so that you can have this this presentation, this webinar. Okay, I think that all the questions have been answered. Well, we have more questions. Well, very good. A question coming from Sandra Mitchell from Norway. Hello, how are you? How wood is low for small wrinkles under the eyes compared to eye bags? Well, as I was telling you, low has this additional indication not to treat just bags, but also this periocular flaccidity. This is very effective when treating this periocular flaccidity. In that case, we will have to apply the product by means of very superficial infiltration, okay? In order to let this flaccidity to recover firmness and elasticity, okay? This is very effective for this specific kind of bags, which are not bags actually, but are flaccidity. Well, I'm seeing here more and more questions. Well, can you repeat the abdominal area? Well, when treating abdominal area, well, I guess that you mean localized fat in this abdominal area. In this case, remember, we are going to apply the combination of hyaluronic acid plus medium, okay? And we are going to perform retro injections. Well, first of all, I recommend that you draw a mesh, okay, in order to identify the different injection points. Okay, so draw the points and then inject the product, apply the product. Okay, we are going to perform retro injections in order to cover the different levels of subdermal tissue. But you need to make sure that you reach this subdermal tissue, adipose panicle. Okay, so if we are treating a very big abdominal area, very prominent fat area, I recommend that you use a longer needle, maybe a 25 millimeters length needle, okay, in order to reach this adipose panicle. And well, leave 1 centimeter between each puncture, okay, and place between 0.3 or 0.4 centimeters milliliters per each puncture, okay? Although it is not compulsory. In the end, it will depend on the specific abdominal area, okay? Well, I am seeing here more and more questions, which is good. Thank you very much for all your questions. Okay, we have this question. If the product goes inside vessel, are there any risk of necrosis? Well, we are talking about local application. We are going to apply all the products at the level of the dermis or at the level of adipose panicule. Okay, we are not going to perform a systemic treatment. Okay, our products are not going to go to the bloodstream, so there is no risk of necrosis or severe side effects. Okay, because we are performing local treatment, very localized treatment. Well, we go with more questions. Okay, questions that have not been answered yet. For instance, okay, how much cc of high product must we apply in keloid scar? Well, regarding keloids, as you already know, keloids can be very big. They can have different size depending on the evolution of the keloid. But as a general rule, there is no need to use the whole content of saline solution to reconstitute enzymes. As you have mentioned, we are going to use high, okay, high product because we have more collagenase, and we are going to reconstitute enzymes by adding different volumes depending on the size of the keloid. Okay, for instance, we can use 10 milliliters. Okay, 10 milliliters would be enough in order to cover all the keloid. Okay, you are not going to need the whole content. Therefore, moreover, we are going to have a more concentrated solution if we use less amount of saline solution. So the treatment will be more effective. Well, we have more and more questions. Okay. Hello, I have a question. When I use PBSerum MEDICAL low for flaccidity around the eye, I do it superficial and I have so much bruises, even when I do not damage the vessels. Is it normal? Well, in the case that you observe many bruises, I recommend that you try the use of the cannula because many doctors prefer to use cannula in order to avoid those bruises. Okay, so you can use cannula in order to treat this periocular area as well. Okay, we have more questions. Please go ahead with all your questions. Don't be shy. We are here to answer all of them. Okay. Can we watch again this presentation? Yes, of course. This presentation has been recorded, and this presentation will be sent to your local distributor in your country, so you can ask them in order to have this presentation. Okay. More questions. This is a question regarding Dupuytren's disease. Is it not better to use pure collagenase in order to treat Dupuytren's? I guess. Well, Dupuytren's is not one of our indications. Okay. In the case of Dupuytren's disease, we would need a huge amount of collagenase, but this is not our case. Okay, we are not addressing Dupuytren's disease with our product. It is true that collagenase is effective for treating Dupuytren's, but in our product we have very specific concentrations in order to treat different pathologies. Okay, we are not treating Dupuytren's with our product. Okay, more and more questions. Would you send this presentation to us by email? Well, I will have to check it. but maybe this is possible. I don't know for sure. Okay, can we use the medium for malar mouth and infraorbital fat pads? Yes, you could, but in that case, we are talking about smaller areas. So maybe it is better to use low product instead of medium product, because I remind you that low product also contains lipase, which is the most important enzyme when treating fat. But when we're treating very little fat accumulation, we can use low, okay, for those smaller areas. Well, more and more questions. Okay. What is the most important point for this product? Well, here, regarding the crucial points, I would say different crucial points. First of all, we are talking about recombinant enzymes. They come from bacterial origin. They are smaller, they are safer and less immunogenic. So this is the first point, okay? We can use this recombination technology, these enzymes, in order to avoid side effects, those side effects that we find with other kind of products, okay? So safety would be the first point, okay? And the second point would be the efficacy, okay? We already have enzymes within our body. They are effective. So this is an additional or extra support to our enzymes. So we obtain a really effective result. So they are really effective. And finally, I would remark the purity of the product. Purity, specificity. We have all this value, okay? So please bear in mind that we are talking about a very specific therapy, so that we can obtain very good results without side effects. Okay, I'm going to check the following questions. Okay. Does it cause acne? Well, up to date, we have not reported any case of acne due to our products. In fact, we could use our products to treat acne scars because those are other kind of scars. So in that case, we could use high in that case, but our products have not caused acne scars. Okay. Do you suggest massaging or heating of treated areas? Well, remember that enzymes, they will perform their activity at a very specific temperature, okay? They will be effective between 37 and 45 degrees, okay, more or less. So yes, you can heat the tissue after the application a little bit, but bear in mind that if you overheat it and you overpass this maximum temperature, you could lose enzyme activity. So please bear in mind that you have to be between this temperature range, okay? 37 and 45 degrees, more or less, okay? No less, no more. Can we use two different products in the same session in different depths? Yes, you can do this. In fact, when treating cellulite, for instance, we are using high in order to treat fibrotic nodules. But when treating cellulite, we also have localized fat. in the legs. So in that case, we could apply both products, high for fibrotic nodules and medium for this fat accumulation. Okay, you would apply each product in the specific location, okay, and at the specific level of depth. But you can do this, okay? You can apply both high and medium in order to treat these two features that we find in cellulite, fibrotic nodules and localized fat. Okay. Well, the following question is: can we freeze reconstituted product? No. The answer is no. Once we reconstitute the lyophilized enzymes, once we add this saline solution, we must use the whole content in that very session, okay? We do not recommend to store product left because we could lose enzyme activity. So therefore, one vial containing lyophilized enzymes is intended to be used for just one session. Okay, so please do not freeze reconstituted product for future sessions, because you are going to lose not only enzyme activity but also sterility. Remember that we are talking about sterile products. So in order to guarantee sterility, please use the whole content for that very session. Okay. When I say whole content, I don't mean that you use the whole content of saline solution. I mean the whole reconstituted product. Okay, but you can use different volumes of saline solution. Okay, but the whole vial for that very session. Okay. Well, can we use this for sagging breast? Well, we have not clinical cases regarding sagging breast. I guess that in that case you mean flaccidity along with fat accumulation, but I cannot say because we have not this case reported yet. But remember that our products are intended for treating this kind of indication, sagginess, fat accumulation, flaccidity. So maybe it could work, maybe. We have not scientific evidence. Okay, we continue with our questions. Okay. How long after another aesthetic treatment we have to wait to apply PBSerum? Well, we recommend to wait 15 days, okay, after treatment. If you have applied to your patient other, so for instance, if you have applied fillers or botulinum toxin or other kind of therapy, I recommend that you wait for 15 days until you apply PBSerum enzymes, just to let your patient recover, and just to let the patient be prepared for the next treatment. Okay. We continue with your questions. Is it true that bicarbonate can reduce burning sensations? Well, we do not have evidence of that. Maybe you could try. But in case of reducing burning sensation, you can apply lidocaine to the reconstituted product. I mean, once you have your lyophilized enzymes reconstituted with high molecular weight hyaluronic acid plus saline solution, then you can add lidocaine in order to reduce burning sensation. This is what we can do. Okay, we have evidence of lidocaine to do that. So this is up to you. This is up to the doctor to use lidocaine in order to reduce this burning sensation due to the application of enzymes. Okay, I think we are reaching the end. Okay. Okay, our following question is, will a combination with radiofrequency enhance the effect of the treatment? And if so, would you do it before or after the injection? In that case, you could use radiofrequency. We have to say that our recombinant enzymes are highly effective by themselves, but you could use radiofrequency in order to obtain a synergy effect, for instance. In that case, you have two options. You could alternate sessions. I mean, one PBSerum session, and the following week, one radio frequency session, and then PBSerum again, and then radio frequency, and so on. And the other option is to apply both of them at the very same session. Well, in that case, you will have to apply the enzymes first. Okay, you are going to apply PBSerum enzymes first, and then you are going to apply radio frequency. Well, this is the sequence, the order. But this is up to you to perform both treatments at the very same session or alternate sessions in order to let the patient recover. I think most of the questions have been already answered. I don't know if we have more questions. Well, we do not have more questions. Okay. Well, we have more questions. Yes, I have identified one more question. Hi, you say this product doesn't restrict the adipocyte membrane. In this case, doesn't localized fat take place again after some time in those cells? Well, as I have mentioned before, lipase is going to enter the adipocytes without breaking cell membrane. So we are going to maintain the integrity. We are not going to cause necrosis in the tissue. Okay. So we are going to reduce adipocyte volume. We're going to shrink these fatty cells, and the effect will remain more or less depending on other factors such as extrinsic factors. As you know, when we're treating localized fat, we have all the different factors such as hormonal regulation, the diet is important, lifestyle is also important. So regarding the effect of the enzymes, this effect may endure until 6 months, more or less, okay? 6 months as general rule. But as I was telling you, this is not, there are extrinsic factors that will vary this time, okay? So it can be 6 months, or it can be more time or less, okay? So depending on these extrinsic factors. Okay, we have more questions. Can we apply low product for lipoma? No. In the case of lipoma, we are going to apply a combination of hyaluronic acid plus medium. This is medium what we are going to apply for treating lipoma, okay? Because in this case, we need a higher amount of lipase, okay? So in this case, regardless the size of the lipoma, we are going to apply medium because we have this fat accumulation. But in the case of lipoma, it's very important to take into account that we can treat non-vascularized lipoma. I mean, if we have lipoma with a lot of vessels, very irrigated, very encapsulated lipoma, in those cases, we must not apply the product. The product must be applied when treating non-encapsulated lipoma. Okay, free of blood vessels, just fat. Okay. This is the case where we apply medium to treat lipoma. Okay, very good. Do you have more questions? Please go ahead. I will try to answer as many questions as possible. Well, I think uh, it has been interesting for you. I really hope it has been interesting for you. So, well, now I would like to say goodbye. Thank you very much. Thank you very much for attending this PBSerum webinar. Remember that this time PBSerum goes to your home. Take care. Take care of yourselves, not only of yourselves, but also take care of the others. Okay. So, and we will see very soon. Take care. Bye bye.